All right, future neonatal nurses, welcome to another deep dive with us. Today,
Yeah.
we're taking a look at, well, I guess getting you ready for
Yeah.
those interviews.
Okay.
And we found this awesome article on Indeed.com,
Oh, nice.
and it breaks down common questions for neonatal nurses. So this will be super helpful for you. Even if you're not getting ready for an interview, it'll give you a really good look into what this field is like.
Yeah. I was really struck by how the article emphasizes right off the bat, like,
Mhm.
you need expertise, knowledge, and compassion. It's not just about the medical skills.
Makes sense.
Right.
You're caring for these tiny, tiny humans
Yeah.
that are just so vulnerable. And the stakes are, I mean,
Oh, incredibly high.
yeah, that's why
Super
we-
high. Think about it. Newborns, and especially preemies, face a
Yeah.
whole world of challenges, right?
Mm.
And so you need specialized care, a keen eye, a gentle touch.
Yeah.
But even beyond that, you're working with families that are going through,
Oh,
you're
absolutely.
going through so many emotions.
Mhm.
So building trust and offering support,
Mhm.
that's what makes a neonatal nurse
Right.
really stand out.
Okay, so let's get into some of these like general questions
Okay.
that they say you're going to get asked. So
Okay.
there's the typical, what led you to this,
Mm-hmm.
you know, and how do you handle ethical dilemmas? Which, oh boy,
Yeah, those are big ones, right?
I bet those come up all the time.
All the time. I think with these, it might seem basic, but
Yeah.
this is your chance to stand out.
Okay.
So don't give like a textbook answer.
Mm-hmm.
Be honest. Think about your journey.
Yeah.
And show that passion. What experiences made you want to work with these tiny babies and their families?
I like that, yeah. There's a question here, too, about breastfeeding support and education for new parents.
Oh, yeah.
And I thought that was really interesting because it feels like that's more than just the medical stuff.
100%. Imagine you're a new parent, you're in the NICU, your baby's hooked up to all these machines,
Right.
you're anxious, you're uncertain.
Oh, my gosh, yeah.
Supporting breastfeeding in that kind of environment.
Yeah.
It's way more than latch techniques,
Right.
It's about sensitivity, empathy,
Yeah.
understanding what
Blend
these
with-
parents are going through.
Like you're building trust.
Yeah, you're empowering them
Yeah.
to be the best parents they can be,
Yeah.
even in this crazy situation.
In these wild circumstances, yeah.
Right.
Okay, let's look at some of the deeper questions.
Yeah.
One was, how do you promote
Yes.
a calm and healing environment in a neonatal unit?
Ooh, that's a good one.
That seems tough.
Well, think about the NICU, right?
Mm-hmm.
You've got the beeping machines, dim lights, worried families,
Oh, yeah.
and then these tiny babies, some premature,
Right.
all struggling to adapt.
Yeah.
It's sensory overload for everyone.
I never thought about it that way. So you're creating like a peaceful place.
Yeah, like a little oasis within this crazy high-tech place.
Right.
It takes a special nurse to manage that.
Yeah.
Someone who can stay calm, reassure those parents,
Great.
and advocate for the best care for those little fighters.
It's a demanding field,
Yeah.
but so rewarding.
Oh, absolutely.
Okay.
Mm.
How do you approach a cultural diversity in caring for these patients and families?
Oh, that's so important.
Yeah.
I mean, the NICU is like a mini version of our world, right?
Right.
You'll have families from all over, all with different beliefs and practices.
Yeah.
So you have to be culturally sensitive
Right.
and respectful.
Yeah.
What might be normal in one culture
Right.
could be totally different in another.
So you have to meet people where they are,
Exactly.
both physically
Yeah.
and emotionally.
Imagine, right? Some families have strong beliefs in traditional healing, along with modern medicine. Others might have preferences about pain management, family dynamics,
Yeah.
even end-of-life care.
So how does that actually look
Sure.
in the NICU?
Well, let's say, right,
Yeah.
you have a baby, and the family believes in prayer and spiritual healing.
Right.
You don't dismiss that. You find a way to include it respectfully
Yeah.
in the care plan while making sure the baby's okay and honoring the family's values.
So it's like a balance.
Yeah, a balance,
Good balance.
respecting beliefs
Yeah.
while providing the best care, building bridges, not barriers.
Okay, the last question here is,
Right.
how do you advocate for your patient's best interest
Oh, that's a powerful one.
in challenging situations?
Yeah.
This feels like the heart of what you do.
Think about it. These babies can't speak for themselves.
Yeah.
You have to be their voice, fight for what they need,
Yeah.
even when it's hard. It might mean speaking up to a doctor if you think a treatment's not right. or advocating for more resources for a struggling family,
Right.
or even supporting parents as they make difficult choices about their baby's care.
You're like their guardian angel.
Oh, that's a nice way to put it.
Yeah.
We're often the unsung heroes, making sure every tiny voice is heard.
Now, they don't just stop at questions in this article. They have example answers
Oh, that's so helpful.
for a few of them, which I think is awesome.
Let's break one down, see what makes it work. How about the one about handling pressure and emotions? Because that's crucial.
Yeah, great.
All right. It really focuses on knowing yourself, like recognizing what your triggers are,
Okay.
knowing when to take a break,
Yeah.
and when to ask for help from colleagues or mentors.
So not pretending you can handle it all.
Right.
Yeah.
It's honest, right? This job, it's emotionally tough.
Yeah.
You're dealing with life and death every day,
Yeah.
seeing families struggle.
Mm-hmm.
So you got to have ways to deal with the stress.
Yeah.
Otherwise, you burn out.
Yeah. They also talk about compartmentalizing.
Yes.
You can't take it all home with you. Great.
You can't. You need to find a way to detach,
Yeah.
recharge outside of work, spend time with people you love, hobbies,
Yeah.
exercise, anything that brings you joy.
Right, right. That separation's so important.
Yeah,
So you can be there for your patients.
exactly. And you know what else?
Yeah. What?
Celebrate those wins.
Oh, yeah.
Even small victories in the NICU are huge. Right?
Absolutely.
A baby breathing on their own, gaining weight, going home.
Yeah.
Those moments make it all worthwhile.
Those little glimmers of hope
Yeah,
make such a difference.
exactly. There's another answer about that calm environment we talked about.
Oh, yeah, yeah.
And it gets into the specifics.
What kind of stuff?
Well, start with the basics,
Okay.
dim the lights, minimize noise,
Right.
use calming colors, maybe play soft music or nature sounds,
Yeah.
even plants.
More like a home than a hospital.
Exactly.
Yeah.
But it's not just the space.
Mm-hmm.
It's how you interact with the babies.
Okay.
Gentle touch, swaddling, talking to them softly.
Yeah.
It all helps.
Creating that little peaceful bubble.
Yeah. And communication with the parents, of course.
Right.
Keeping them in the loop helps with their anxiety, too.
That partnership is so important.
It is.
Yeah.
It is. Let's look at prioritizing tasks now. That NICU environment,
Oh, yeah, yeah.
it's fast-paced,
Yeah, I bet.
unpredictable.
A constant juggling act.
Yeah. So the answer here talks about staying organized.
Right.
Checklists, care plans, that sort of thing.
Working smarter, not just harder.
Exactly. And knowing how to delegate, right? You're part of a team.
Right.
Recognize when someone else can handle something.
Yeah.
So you can focus on the critical stuff.
Yeah. Using everyone's strengths.
Right. And the biggest thing,
What's that?
flexibility.
Of course, yeah.
Things change so fast in the NICU.
Yeah.
A baby's condition, new admissions. You have to adapt and reprioritize constantly.
Think on your feet.
Exactly. Always keeping the baby.
You'd be like an NICU Zen master or something.
Love that. Okay, last one from the article.
Mm.
It's about advocating for patients, even in the tough situations.
Yeah.
This is where the heart of the role comes in.
It's such a big part of it.
Yeah.
How do they say to approach it?
Well, they really focus on communication.
Yeah.
Clear, respectful, empathetic,
Yeah.
It's about really listening to the parents' concerns,
Wow.
explaining things so they understand,
Yeah.
involving them in decisions whenever you can.
So you're empowering them. Right.
Yes,
They're not just watching, they're part of it.
exactly. And it talks about collaboration, too.
Mm-hmm.
You're the bridge between the parents and the medical team,
Okay.
advocating for everyone's needs.
So it's almost like you're in two worlds, right?
Yeah.
The medical world
Yeah.
and the family's world,
Mhm.
and you're,
You're bringing them together.
yeah.
And don't forget documentation.
Oh, right, yeah.
Keeping good records is important for advocating well.
Like a paper trail,
Yes.
showing what you've done.
Exactly. And lastly, self-care.
Oh, yeah, that's so important.
Advocating, especially when it's tough,
Mhm.
it can really take a lot out of you. You
Oh.
got to take care of yourself to be a strong advocate.
It's like they say, you can't pour from an empty cup.
Exactly. Okay, so
Yeah.
we've gone through a lot of info.
We have.
Yeah. Let's think about our listener now who's probably taking all this in, getting ready for their interview. What are the big things to remember?
Well, I think, like, we've seen what it really takes to be a neonatal nurse. Not just the medical stuff, but the emotional stuff, too.
Right.
So what do you think is the most important thing for our listener to focus on?
I'd say be prepared.
Yeah.
Know the common questions, think about your experiences,
Hmm.
and really show not just what you know, but how passionate you are about this work.
Yeah, because like you were saying earlier, it's so much more
Oh, yes.
than just the medical expertise.
Yeah.
It's that real deep compassion and dedication.
Exactly. And that's something you can't fake. It has to be real.
Yeah.
So think about, like, what drew you to this in the first place? Was it something personal,
Hmm.
wanting to help babies?
Yeah.
Or maybe you're fascinated by the science?
That's good. Yeah, I like that. And the article with those example answers, that's super helpful.
Oh, incredibly helpful.
Yeah.
It shows you what a good answer looks like, not just what to say,
Right.
but the tone, the details.
Yeah, yeah. Like you're seeing it from the interviewer's side.
Exactly. But,
Mm.
beyond all the technical stuff,
Yeah.
what really stands out to me are the personal qualities.
Yeah, absolutely.
Empathy, resilience, patience,
All right.
staying calm when things get crazy.
Those are the things that make a great nurse.
They are.
And you can't learn that from a book.
That's true.
That's got to come from you.
So here's a question for our listener.
Okay.
As they go on this journey to become a neonatal nurse,
Hmm.
what qualities do you think
Yeah.
would make you a great nurse? What are your strengths?
That's such a great question. I love that. I think after this deep dive,
Mm-hmm.
anyone listening is already doing great.
Yeah.
They've got the knowledge,
Mm-hmm.
they've got the insights, and hopefully a renewed passion for this incredible field.
I hope so. To our listener getting ready for that interview,
Yeah.
we're rooting for you.
Yeah.
It's tough, but so rewarding.
Just think about the impact you'll have on these little lives.
Yes.
And the families.
Mhm.
You're not just caring for babies, you're giving them a chance.
Yeah.
A brighter future.
And it's a journey, right? You're always learning.
Absolutely. Every
Yeah.
day in the NICU is different. New challenges, new ways to make a difference.
Yeah.
Embrace it all, learn from everything,
Yeah.
and never forget what a privilege it is to care for these little ones.
Mhm.
That's so well said. And that's our deep dive for today.
Thanks for joining us.
We'll be back soon with more. Until then, keep learning and keep diving deep.